primary care clinics throughout this particular area. So we taught our first course, Harvard School of Public Health, Introduction to Global Health Delivery. We taught about 10 cases, and the students loved it. We just got the reviews back, and moreover, they'd never heard any of it. These were some of the brightest students. I mean, they got into Harvard School of Public Health. They'd had a lot of experience in global health, and they just didn't know any of this stuff. But, you know, even my colleagues are still saying, no, you know, we shouldn't be so ambitious. We shouldn't really treat HIV. We should just, you know, use money in the most cost-effective way. We shouldn't really think about value and do whatever it takes to reach value. We should keep our aspirations low. You know, this is something I've been fighting for most of the last 20 years. Why should our aspirations be so low when it comes to poor people? Excuse me. You know, the Gravina Access Project in Alaska was advocated by Senator Stephen and Representative Young from Alaska. And it ended up at a cost of $400 million. And this was at a time, I mean, this was a bridge to link a community of 50 people with a huge megalopolis of 8,000 people. And the people in that community were even saying, no, we got boats, we're doing okay, we don't need a bridge. But Senator Stevens and Representative Young advocated so hard for this bridge that when Katrina hit, the proposal was to divert funds from the bridge to nowhere to Katrina, and they got on the floor of the Senate and the House of Representatives and screamed bloody murder. Senator Stevens threatened to resign if they took money from the bridge to nowhere and diverted it to Katrina. That's the kind of advocate we want for global health. But who is going to advocate for this child? This child is Thelma, and we found her in a clinic in Peru. She was suffering from both tuberculosis and HIV, and she wasn't doing very well. And so our community health workers found her and said, we can help. The mother at this point, who was also HIV positive, wanted to just take her home so she could die. After about 6 months of treatment for both HIV and TB, she looked like this. Who will advocate for Thelma? In this case, our team did in Peru, but who will advocate for her among the rich and the powerful who would rather spend money on bridges to nowhere? Sugar. I'm going to really get myself in trouble here, but you know, we pay about $2 billion more for sugar on any given year than we have to, through a mixture of loans and price supports and import quotas. We still have a thriving sugar industry in Florida, and we have no business having a thriving sugar industry if we obey the rules that we apply to every other country. Open your borders to competition. The Cubans are so angry that we're not letting Cuban sugar. The Dominicans and others, I mean, this is a constant battle, but the sugar lobby knows what it's doing. $2 billion a year. This is Jean-Luc from Haiti. He came to us with that very exotic disease, malnutrition. And with even more exotic treatment of food, this is what he looked like. What about corn? I grew up in Iowa. You know, you can tell from my appearance I grew up in Iowa. And I love Iowa farmers. I still love the Iowa Hawkeyes. But over the past 10 years, the corn industry has gotten subsidies of 51 billion, so about $5 billion a year. You know, an Iowa farmer once said at a meeting that if corn subsidies are socialism, then I'm a socialist. These are projects that started during the Depression, corn subsidies, right? Now, I'm not an expert on these, and I'm not saying that Iowa corn farmers shouldn't get these subsidies. I'm not an expert. But what I'll tell you is that these folks know how to lobby. They know how to advocate for themselves. This is Asefi, right? She's from Haiti. Asefi means no more girls. Lots and lots of girls in Haiti are named Asefi. She came to our clinic with tuberculosis and malnutrition. And again, with tuberculosis treatment and food, she looked like this. What about the defense budget? Now, you know, a lot of my friends from Iowa went to college because of the military. I am not against the military. I'm just telling you that these folks know how to advocate. Look at the defense budget and what we spend on foreign aid compared to other countries. And then look at what the American people actually think. So the Pew folks and a lot of others for the last 20 to 30 years have been doing these surveys every single year. And they ask Americans, how much of the federal budget do you think we spend on defense? And in this particular survey, 18% guessed less than 3%. It's actually 1.6%. Most of them thought it was around 10%. When asked what percentage should be allocated to foreign aid, the median response was 15%. Right? Now, I don't know what to make of this. It drives me crazy every time I see it. What we're talking about, to be able to provide decent health care for every single person on the planet. And you know, I'm not against having local governments spend money on health care. I think they should. All the African countries committed to 15% of their budget for health care expenditures at a meeting in Abuja, in Nigeria. I think they should do that. But even if they do that, some of these countries are so poor, they're not going to be able to care for their people. But for $25 a person, we were treating people in Rwanda. If we can double that to $50 per person, we would be able to provide very decent health care to every person on the planet. And my argument to you is that that's something worth advocating for. This is a Harvard Medical School mission statement: to create and nurture a community of the best people committed to leadership in alleviating human suffering caused by disease. To live up to that mission statement, I think we have to do three things very, very well. I think we have to get real about what we're spending on what, and focus in on what I believe is the deep, deep compassion of the American people. I think the American people want to provide health care for everyone on the planet. We've just got to make it clear that we're not doing it now, but boy, we could. And if we did do that, how differently people would see us in all the parts of the world. You know, I was in Geneva for 3 years, and I have to tell you that when that war started, it was not fun being an American in Geneva. The estimation, the way that people think about Americans is worse than I've ever seen it. And I've been traveling all over the world for 25 years. It's the worst I've ever seen. So first, let's get the money and let's focus. But the second thing we have to do is we've got to get as good and as rigorous and as committed to delivering high quality care as the businesses are about making money. That's what I learned. The businesses care more about getting that stuff right than we do in healthcare. In fact, we do nothing almost to try to get that stuff right. So we're trying to build a new field. I really need all of you, especially those of you who are in this field already, to work with us. We need to write thousands of cases. We need to create a cross-university dialogue about what's working, what's not, what are the secrets. You know, everybody in the business world knows how Southeast Airlines works and why they're so successful. And nobody in our field knows how smallpox was eradicated. It makes no sense. The third thing, though, is that we have to open our hearts to the suffering of people like Jean here. He came to our clinic in Rwanda suffering from tuberculosis and HIV. But his CD4 count, which is an indication of the progression of his HIV disease, was very high, so he didn't need HIV drugs. And in about 3 months, with just food and TB treatment, he looked like this. So he's developed such a belly, actually. We got him on an exercise program. But I leave you with this image, and I leave you with this thought. My field is anthropology, and one of the great anthropologists of all time, Margaret Mead, once said, probably people have later commented to me quoting Lenin of all people, but Margaret Mead once said, never doubt the ability of a small group of committed souls to change the world. Indeed, they're the only ones who ever have. Thank you very much.